Hello, beautiful people.
Hello.
Please no gloves, that's all I'm asking.
You can start it.
You've only recently started experimenting with drugs. This is only natural in college, right? Your best buddy Ross lets you know that he managed to score some oxy from his grandfather's medicine cabinet. You two have the whole night planned out. Pizza's been ordered, the newest Marvel movie just came out on Redbox, and you have the whole house to yourself. After about 30 minutes, you go outside to smoke a cigarette, and you come back in to find your buddy Ross laying on the couch, motionless, barely breathing, and covered in vomit. Do you know what to do? My name is Sydney, and I'm going to demonstrate how to respond to an overdose. When responding to an overdose, one must be able to identify an overdose, perform life-saving measures, and assist in the recovery of the person. Now, let's get to saving the life of your friend. Even if you only suspect an overdose, call 911 right away. Next, you're going to want to check the scene for any potentially dangerous materials such as open needles or suspicious substances. Then you're going to check for symptoms of an overdose. Symptoms of an overdose include pinpoint pupils, shallow breathing, slowed heart rate, vomiting, low heart rate, vomiting, blue fingernails, blue lips, and loss of consciousness. Next, you're going to perform life-saving measures. If available, administer naloxone, better known as Narcan. Narcan works just like any other nose spray. You just take it out of the box, insert it into the person's nose, and pull the plunger down. If the person is not breathing or does not have a heart rate, administer CPR right away. If you don't know how to do CPR, the 911 operator will assist you along the way. CPR consists of 30 compressions, 2 to 2.5 inches deep, and 3 breaths. If Narcan doesn't result in the person gaining consciousness within 2 to 3 minutes, you can administer a second dose. Do not stop CPR until the person is breathing independently. Next is the recovery phase. Can I get a volunteer, please? Come on up. I'll have you lay down. I'm going to show you what the recovery position looks like. You're going to roll the person onto their left side with their right hand under their face and their right leg bent outwards. This assists in open airways so that they can breathe better, and it prevents aspiration. Thank you for your help. You can be seated now. Even if CPR and Narcan is successful, do not leave the person until EMS arrives. They can lose consciousness again, or they may need CPR. That's it. You've done everything within your power to help save the life of your friend, and the rest is in the hands of medical professionals. You now know how to respond in this scary yet very real situation. You know the signs and symptoms of an overdose. You can respond quickly with CPR and Narcan, and you can assist paramedics by monitoring and assisting in the recovery of the individual. Although I've only used an example scenario, many people are threatened with overdose daily. Overdose is at an all-time high, and people are dying every single day. Although death from substance use is not always avoidable, if you can at least try to save a life, wouldn't you? Thank you.